Hello, Bill.
Hey guys, how you doing?
Good. I'll be introducing you today.
Okay, perfect.
They call me Host 500, but my name is really Keith. So it's
Hey Keith, good to see you.
I have to rename myself here. All right. Well, good. So where are you located right now?
I'm in Tampa
Okay.
at my house.
Nice. All right.
Yep.
I've got your description that you put into the speaker profile, or someone put it in there.
Mm-hmm.
And I'm going to read this. Is there anything else that you'd like me to say?
No, that's great. I mean, I've spoken to the Georgia group in the past, so
Well,
a lot of people know.
Yeah. I've heard you speak probably 3 times, I think, over the
Okay.
years. Yeah, probably. All right, good. A lot of the people are in the carrier panel right now. I was there a minute ago, so there was a big crowd there. They'll be filtering over here, I'm sure, right at 9 o'clock.
Okay.
It won't be open for people to join until 1 minute till 9. I think that's the way the system works.
Okay.
And then my assistant's going to monitor the chat box. Raquel, are you there? I don't know if she can hear me or not. But she's going to monitor that for questions. I'll monitor it also. I'll turn off my video. We'll make sure that we'll mute the participants, and we'll unmute them if we have questions.
Okay, and I think we're going for 30 minutes, right? Do you want me to leave some time at the end for questions or?
Yeah, you want to do 25 minutes to 27
Okay.
minutes and leave 2 or 3 minutes for questions. If you want people to interrupt you and ask questions during the presentation, tell me now,
I mean, it doesn't really matter to me, to be honest with you, but if that'll be something that I guess we'll see how it goes. I mean, if we start seeing some stuff come in there, if you want to pop in and just say, hey, we have a question about whatever. Typically, since it's only going to be a 25-minute presentation, it might be best to just kind of wait till the end. But again, if something pops up for a specific, or maybe you can even say that to people if they want to put something into the chat box, we'll try to address it. I know my problem is as I'm presenting often, it's difficult for me to monitor the chat box at the same time.
Well, no, we're gonna monitor it for you. Now, do you have a presentation that you're going to share on the share?
I do. Yeah, I'm going to share my screen. Right? Is that how that's how it's going to work like any other Zoom?
That's correct. And so we'll make sure. All right, good. All right, so we'll help you out. It's going to start here. It's 1 minute now. We should start seeing some people come in a moment. And then we'll be able to get started at 9 o'clock. So it's 8:59 right now.
Thanks. And you're just going to throw it over to me, right? And I don't need to do anything different. I don't need to turn anything else on. It just the screen will be mine at that point.
That's correct. I'm just going to introduce you.
Okay, great. Thanks.
You are listed as, make sure on this. Yeah, you're listed as host. I'm listed as co-host. So you've got all privileges. Yeah.
Okay, cool. Thank you.
All righty. So as soon as 9 o'clock hits, we'll see if anybody's in there. We got 3 extra participants right now, so we'll be ready to go at 9.
All right.
That's good. As soon as the clock turns over. Hello, everyone. Thank you very much for joining us today for our breakout session on prescription drugs. And we have a terrific speaker today. His name is Bill Hepscher from the Canadian Med Store. And I've heard Bill speak about 3 different times over the past years at our Medicare Summit. And he's speaking from Tampa, Florida today. He's been a healthcare consumerism advocate for at least 15 years. He's the founder of the Canadian Med Store, which is Florida's premier provider of affordable international prescription medication. Fueled by a vision that all Americans should have access to safe, affordable medications, the Canadian Med Store opened its first storefront location in Zephyr Hills, Florida in 2003. The Canadian Med Store now has 6 locations throughout the state of Florida and serves thousands of clients from all across the United States. Bill currently serves as the Director of Sales and Marketing for RX Manage, working closely with health insurance brokers, benefit consultants, and C-level executives to implement cost-effective alternatives to traditional prescription drug benefit models. Bill, thank you very much for being here today, and the floor is yours.
Thank you, Keith. I appreciate it. First, let me just say thank you to the Georgia Association. Typically, I travel to your Medicare Summit, and I travel to your symposium several times. Obviously, this year is a little bit different, but I want to thank you for giving me the opportunity to speak to you today. I'll briefly tell you what we're going to talk about, then we'll talk about it, and then we can ask some questions. But I do want to say one thing to the group, only because I have spoken to the Georgia group in the past, and I just think it's important to know kind of my background. I don't come from the pharma industry. I don't come from the, as an attorney for the pharma industry or for the PBM industry. I really work as an advocate, and I think that makes me at least uniquely positioned, let's just say, to address these type of issues, to come at it from a consumerism from that kind of an aspect, come at it from the same way you do as an agent or a broker when you're talking to your clients. But I think it's important to know, several of you know from hearing me speak in the past, that the reason I founded my company, the Canadian Med Store, was because my brother was diagnosed with non-Hodgkin's lymphoma when he was 27 years old. Went through a bone marrow transplant, and quite honestly, we had what would have been a very, very large medical bill. But my brother's bills were manageable because he had a great health insurance agent that convinced him that even though he was a 20-something invincible, he still needed to have some kind of health insurance protection in place. And that's why I'm so devoted to this association of GAHU. My parents turned 65 just a few years ago, and I can tell you, I never really noticed the struggles until they left their group plan and went onto a Medicare plan. And it was the Medicare agent here in Tampa that walked them through that process and helped them with it. So I understand what you do every day. That's the reason that I'm a member of GAHU. And if you're not a member, if you're attending this summit and you're not a member of GAHU, you need to change that. You really need to become a member of this association, because this association is truly the forefront of the leaders in the health insurance industry. And when you're looking for information about Medicare, events like this are a perfect example of a way to do that. So I just wanted to thank the association, and we'll get started. So today we're going to talk about politics and policy impacting prescription medications. And the reason I say politics and policy is often there's legislation that actually impacts the cost of medication, but more often than not, it's politics. We see a lot of things that come up quite a bit that are talking points, but don't really ever get accomplished. If you've been working in the Medicare industry for as long as I have, working in the prescription drug industry for as long as I have, you'll know that every few years, it seems like almost every 4 years, when there's a presidential election, there starts to be a lot of talk about prescription drugs and how we're going to lower the costs. And we don't often see that come through. So let me share my screen with you, and we'll talk about kind of the history of that, and kind of why we are where we are today and how we got here. So let's get this started for you. So let's briefly talk about the history of prescription drugs and the cost of prescription drugs and policy that has impacted that. I put up this because it's very important to know that you're hearing a lot of talk, not only at the state level, but at the federal level, of prescription drug costs and rules and laws that are going to help lower those costs. Just a couple of weeks ago, the president signed a bunch of executive orders because he said Congress wasn't getting anything done that's going to lower the cost of prescriptions. We'll talk about how that's going to impact the industry, but we're also going to talk about how a lot of those points maybe are going to fall flat because there's not really a lot of meat on that bone, let's just say. So real briefly, let's go back to Medicare. When Medicare first was enacted into law, what most folks don't realize, if you're new to the industry, is that Medicare didn't include a prescription drug benefit at the time. Medicare was there to cover folks with hospitalization and doctor coverage, but it didn't have a prescription drug benefit. And it wasn't that they didn't cover prescription drugs because somehow they didn't see it as an issue, but, well, maybe I should say that. Maybe they didn't see it as an issue, because if you look at the statistics, back in the early 60s, the concern was really hospitalization and doctor coverage. The cost of prescription drugs was only 2% of our overall healthcare spend. nothing like it is today. Today, it's as high as 26, even 30-something% of the overall healthcare spend. So when they created Medicare, it wasn't that they were trying to avoid covering prescription drugs. It was just that it wasn't really a big need. Back then, we didn't have pharmacology like we do today. If you had a stroke or a heart attack, you went into the hospital, and typically, you died in a couple of days. You didn't stay alive for another 10 and 20 and 30 years because of pharmacology. So Medicare didn't even cover prescription drugs at the time. Once we start to push forward into the 80s and really into the mid 90s, you'll see that the prescription drug cost starts to become a major concern for individuals. As a matter of fact, in 1999, AARP did a survey, and for the very first time, seniors reported that their number one concern was actually the cost of their medication, affording their medication. Prior to that, it was outliving their savings. In 1999, it became the concern that they were going to not be able to afford their prescription drugs. The Clinton administration tried to attack that through Hillary Care. But if you talk to most policy people or folks that kind of are Monday morning quarterbacking the Hillary Care kind of movement, you'll notice that the Clinton administration, the mistake they made was that they didn't partner up with the pharmaceutical industry and the insurance industry. As a matter of fact, the insurance industry and the pharmaceutical industry spent millions and millions of dollars to lobby and to put out talking points against Hillary Care. And it failed, as we know Hillary Care did in general. The Bush administration, obviously a Republican administration, came in and recognized that prescription drugs was such an important issue, especially to seniors, that they basically capitalized on that. Now you have to remember, much like when we passed the Affordable Care Act, the Bush administration controlled the White House, they controlled the Senate, and they also controlled the Congress. Therefore, they were able to push the legislation through. And they recognized that although it was normally a Democratic issue about lowering the cost of prescriptions, that the Republicans saw that as a good political win, and they knew that seniors were concerned about that, so they passed Medicare Part D. But Medicare Part D, under the Medicare Modernization Act, didn't include any type of ability for Medicare to negotiate drug prices. And the reason for that was that the Bush administration learned from the failures of the Clinton administration and recognized that instead of going to war with the pharmaceutical industry or the insurance industry, that they needed to bring them under their tent. So they went to the pharmaceutical industry and they said, listen, guys, we need you to get behind this thing. We can't have you against this. And what we're going to offer to you is we're going to not only cover a lot more people, not only give them prescription drug coverage, which means you're going to sell a lot more drugs, but we're not even going to negotiate the price of the medication. So under the Medicare Modernization Act that creates Medicare Part D, it actually makes it illegal for the federal government to negotiate the price of prescription medications. So when you think about that, Medicare, the largest purchaser of prescription drugs in the entire world, can't even negotiate the price of those prescriptions. And we can do a whole nother 3 hours on talking about how that impacts our prescription drug costs across the board, how that impacts large groups and small groups and even individuals. And the reason for that is because, let's face it, if you work in that industry, you know that typically reimbursement is based on some type of a Medicare allowable amount. So if Medicare pays $100, the insurer is going to reimburse in a commercial plan, up to 150% of Medicare. Well, the Medicare benchmark for prescription drugs is really whatever the heck the pharmaceutical industry wants to charge. So not only does that cause the Medicare cost to go through the roof, but it causes our cost of prescription drugs across the board to go through the roof. What I think is very interesting, if you look at this slide, you'll notice that when we talk about lowering the cost of prescriptions, we talk about in here where we're in Medicare, there is no prescription drug coverage. We're not spending all that much money on prescription medications. You'll see in 1980, we spent about $12 billion, accounted for about 5% of the total healthcare cost on prescription medications. In 2016, it went up to 10%. We spent $330 billion on prescription medications, and that's projected to double over the next decade. The reason I show you this slide is you'll notice when we implement Medicare Part D, the cost of prescriptions actually increases. When we implement Obamacare, the ACA, you'll actually see that the cost of prescriptions increases, not decreases. Now, maybe for the typical individual who's paying a little less at the counter for their prescription medications, you'll notice that the cost has come down, but the actual cost to the to us as taxpayers has gone way, way up. And if you speak to most seniors, they'll tell you that prescription drugs are quite expensive. One other thing that I think is important to know, and this talks about the politics of it, is we all look at Medicare as probably a program that we all just kind of accept as an entitlement program, and we love it. And if you talk to most seniors, they really, really like Medicare. They don't want to lose Medicare. When it was implemented under the Johnson administration, it was a very controversial issue. As a matter of fact, Ronald Reagan, who was the president of the Screen Actors Guild at the time, actually was brought on to lobby for the AMA to say, we don't want Medicare. It's socialized medicine. You have to remember that this was the time of, the Red Scare and the communists and the fight, the Cold War with Russia. So anything that was looked at in that way was frowned upon. Much like we're talking about today, when Medicare Part D was passed, most seniors liked Medicare Part D at this time. It was a very contentious issue. It only passed by one vote. And the senator who voted in favor of it at the end was a senator who represented a large amount of insurance companies in Nebraska. So you'll see that we've kind of forget sometimes these programs that we really like, that we love. When they were first implemented, they weren't viewed as positively as we probably look at. So let's just talk about some policies and some laws that have actually been passed. This cartoon down here is actually a picture of somebody, some people call him Pharma Bro, Martin Shkreli, who was a trust fund kid, started a hedge fund, made millions of dollars, and then bought a drug company for the specific purpose that that drug company was the sole manufacturer of a particular medication. When he bought the company, he increased the price of that one medication that nobody else produced by 500% overnight. Of course, there was huge outrage with that. They had political hearings. They brought him up to Congress to testify. And what he said was that he had no moral obligation to the consumers. His only moral obligation was to his shareholders. Well, Mr. Shkreli is currently serving time in federal prison. Just so you know, not because he increased the cost of the prescription medications by 500%. There was nothing illegal about that. He was allowed to do that. He's currently serving time in federal prison for defrauding those same exact shareholders that he said his moral obligation was to. So I guess the moral of that story is if you're a bad person, you're probably a bad person no matter what. But because of that outrage, there was a lot of states who said they wanted to pass transparency laws and basically say, if you're going to increase a drug price by X amount percent, that you're going to have to bring that in front of the Attorney General. Maryland was the first state to do that, and they actually passed the law. And they said that if the drug price increases by more than 50%, it would have to go in front of the Attorney General of the state, and the Attorney General would have to approve that increase. It was challenged by the pharmaceutical industry, and it was found that that law was unconstitutional. So the Maryland law, although that was the forefront of creating some legislation like that, has kind of fallen by the wayside because it was found to be unconstitutional. There was 26 other states that were implementing similar programs, but because it was found unconstitutional, there's not really much traction there. Interestingly, the reason that it was found unconstitutional was that it said that drugs are sold interstate interstate from different states. So therefore, Maryland, being one individual state, doesn't have the constitutional right to regulate pricing in any other state. So that's why it was found to be unconstitutional. Let me just exit out of this for a second. I want to go into some other new stuff. This is last week we talked about how the president had passed some executive orders. And I think they're very, very important to touch on because these are obviously very politically it's a political opportune time for these to be introduced. The reason I say that is most people that know about this legislation is saying that there's probably not much of a chance that it does much before the election, but it is a very trying to present this. Sorry, these are things that are very, very important to the politics of it. Interestingly, a lot of policy folks say that if this was introduced probably prior to COVID, this could really be a game changer for the presidential election. When we look at polls, especially with seniors, the number one concern still seems to be when we talk about healthcare is access to care and prescription drug costs. Most of the polling that's come through Kaiser Family Foundation especially has done a lot of polling across the country and have found that actually prescription drug costs have fallen down to about maybe 5 on the list of important healthcare concerns. Mainly because of COVID. When you look at the issues that are so important, COVID is right up there as number one. And then often it's access to care. A lot of folks weren't able to see their doctors, have been introduced to telemedicine and things like that. So that's become the big, real concern of most people. I personally believe as we start to get closer to the election, and of course we're only 6 weeks away now, I think that the cost of prescriptions is really going to become another important issue, mainly because people do vote with their pocketbooks, especially seniors. And when you start to get into states like mine, the state of Florida, where we have so many senior voters, it's such an important voter block. I think the cost of prescription drugs is going to be pretty important. So I think a lot of these executive orders that the president put out, they knew at the White House that this wasn't really going to lower the cost of prescription drugs, certainly not prior to the election, but at least they could say, listen, the Obama administration under Vice President Biden didn't do anything about prescription drugs. Congress isn't doing anything. At least the president is doing something to address prescription drug costs. And that's largely the reason I say that this is more political than it is actual policy. Well, let's talk about those 4 executive orders that he passed. The first one has to do with a very, very hot topic of insulin, the price of insulin. What this executive order does, and if you listen to the talking points, they'll say it lowers the cost of insulin, and it does. But the problem is it only lowers the cost of insulin to folks without access to affordable insulin and injectable EpiPens, basically, through commercial insurance or federal programs. So what that means is if someone doesn't have access to commercial insurance, basically the uninsured, they don't have access to this lower cost insulin. There's also all kinds of barriers having to do with income and things like that. But the reason I say that is when we're speaking here at a Medicare summit, most of your clients that have access to a Medicare Part D plan aren't going to have access to this lower cost prescriptions because they have access to an insurance plan through a federal program. So this is something that's a very good talking point. Everyone's concerned about the cost of insulin, but how many people are really going to benefit from it? It's very hard to say. Another hot topic, especially I think in our industry, maybe the average person that doesn't work in the insurance or benefits industry doesn't really understand what a rebate is. But a rebate is one of the hot topics in our industry. And what this law does is, or this executive order does, is it actually eliminates rebates in the Medicare Part D program. So this does impact the Medicare industry very, very significantly. Basically what it says is that the rebates that are going to be taken by the PBM or by the health insurance company when they negotiate the price of prescriptions. Remember, the federal government can't negotiate, but when a plan comes in, they can say, hey, listen, we're going to make X drug part of our preferred drug list if you give us discounts on that, and they get those discounts through rebates. Currently, the carrier or the PBM keeps those rebates, keep those discounts. What this executive order says is that it's going to that savings should be passed on to the actual beneficiary at the point of sale. Makes total sense. Everybody agrees with that, obviously, except for the pharmaceutical industry or the PBM industry and the insurance industry. But most folks say, yeah, that makes sense. If there's a savings there, we should give that back. The issue becomes the Medicare kickback laws, which basically says you can't incentivize somebody to buy a certain plan because they're going to get a benefit from that. So what this executive order does is basically eliminates that kickback exclusion and allows for that to be paid back to the beneficiary. The poison pill in here really becomes that the provision says that it cannot increase the Medicare premium, and it's estimated by CMS that the premiums are going to rise by about 25% if this executive order is implemented. Therefore, almost by default, it can't really take place, because if you're going to provide that discount, but then it's going to cause premiums to increase, it simply can't go into effect. The next one is actually one that's very near and dear to my heart. We've been working very, very closely with the governor here in Florida and the White House to implement importation of safe medications from pharmacies in Canada. Now, under the Medicare Modernization Act that created Medicare Part D, the law actually says that individuals can purchase those medications from a pharmacy in Canada or other international pharmacies. But there was always a provision within that law that said that the Secretary of Health and Human Services had to sign off on those medications that were coming from Canada or foreign countries. Well, no Health and Human Services Secretary has ever done that before. The HHS has always allowed for individuals to order up to a 90-day supply of medications for personal use, but technically the secretary had never signed off on that. Under this executive order, the president is basically ordering Secretary Azar to create a program that assures that those drugs that come from Canada are safe. So this is something that has a lot of traction. States like Florida and Vermont have already passed laws that will give them access to prescription medications through international pharmacies. And if this gets some traction, which it sounds like it will, states will be allowed to actually purchase in bulk from pharmacies in Canada and import those drugs. The problem becomes countries like Canada, who have already negotiated very low drug pricing, don't necessarily want to say, okay, let's negotiate these low drug prices so we can export the product to the US, who's going to pay us a little bit more for those medications. And the pharmaceutical industry certainly isn't going to say, yeah, let's increase the amount of Advair inhalers you're ordering, province of Manitoba, because we know you're going to turn around and sell those to the US for a lower price. So whether or not this really works, whether or not the country the size of Canada with 30 million people versus the US with 330 million people would ever be able to be the drug cabinet of the US, probably doesn't happen. But the policy is very important, because what it does is it causes the pharmaceutical industry to come to the table and actually justify why us here in the United States are spending so much money on the exact same medication that the Canadians are paying half or a third of. The next one is an executive order that's kind of based on that same type of idea, but what it does is it creates an international pricing index. So Medicare, under Secretary Azar and President Trump, looked at the costs that we were paying in the United States for prescription drugs versus what other industrialized countries were paying. What they found is that we were paying 2 and 3 times as more than what those countries were paying. So basically what this law says is that we're going to create an international pricing index, and we're going to say if the Canadians and the Brits and the Aussies and the New Zealanders are paying, $100 for a drug, we're not going to pay $300 for it anymore. We'll pay a percentage of the average of those other industrialized nations. It'll be interesting to see if this works, because again, these countries have negotiated lower drug pricing, and are they necessarily going to share that data? How is that going to negatively impact them? Obviously, the pharmaceutical industry, if they're not going to be able to make as much money on the American consumer, are going to pass that on to those other countries. So it'll be interesting to see how this plays out. But if you notice, a lot of these talking points or a lot of these executive orders fit right into the president's let's just say his America First mindset, his idea of whether it's talking about NATO and then, the NATO countries not paying their fair share, or the tariffs with China, it fits right into the mindset of saying, why are we taking advantage of America? So it fits his political talking points. And the reason why I say that's so important is that most of these ideas that have come through these executive orders were actually introduced by, sorry, I'm just looking at my time, were actually introduced by the left, often by people like Bernie Sanders, who has been a supporter of international importation for a long time. He's one that's talked about the international pricing index. The difference is he's always attacked it as, well, Norway and Denmark are socialized medicine countries, and look at the way we do it, we should do it like them. And President Trump is attacking it in a bit of a different way, more in a free market way, saying, listen, if they're going to pay that, we're going to negotiate and bring in a lower price, because we're not going to pay more than what the Canadians are paying. So I think it's interesting that the ideas are the same. It's how is it trying to be sold to the American people, and how does it sell to your base? So that's that. I'll stop and take some questions. The one other one that the president just signed into law, or just signed as the executive order just this weekend, basically was around that same issue of the indexing, but basically telling the pharmaceutical industry to come to the table with some ideas, or he was not only going to apply that to Medicare Part B drugs, meaning the drugs that are dispensed within the doctor's office, but also the Medicare Part D drugs. And it'll be interesting to see how that works. And there'll definitely will be challenges from the pharmaceutical industry to say that they're going to be controlling pricing. The president's argument is that we're not going to set pricing, we're simply going to negotiate lower prices, and we're going to base that negotiation on what other countries are paying. So that's kind of where we are. I only had 25 minutes. There's a whole bunch of legislation going on out there. I just encourage you to, follow these things, stay in touch with your Congress people. If there's an issue and you have any questions about it, come to me. I'll be happy to give you my opinion on it. I'm certainly not an expert on everything, but I can give you an opinion. So I'll open it up to any questions that anybody has, and I'll leave my contact information. So if we run out of time, you want to reach out to me later on, I'll be happy to help you. And if you need help with your clients and helping them access drugs from safe, affordable pharmacies in Canada, we'll be happy to help you with that as well.
Bill,
yes,
we have a question, but also I want to remind all of our people listening in that there is a speaker profile in the forum where you can go in and look at all the speakers' information. So Bill, make sure that all your contact information is correct there. Okay. We have a question from Danny. He says, understanding that Medicare as an entity cannot negotiate the price of prescription drugs, I thought that the private insurers administering Part D benefits could negotiate these costs.
That's right. Yeah, they do. And the private insurers do negotiate the cost of those prescription medications. So the federal government can't, as a public entity, as saying, hey, we're the largest purchaser. You have to remember, under Medicare Part D, Medicare, us, the taxpayers, subsidize a large part of Medicare Part D, so we're paying for that. So the argument is that Medicare should be able to step in and argue or negotiate those drug prices. But you're correct. The drug company or the PBMs or the carriers can negotiate those prices. The problem becomes if you're a pharmaceutical company and you hold a patent on a drug, which means you're the only manufacturer of that drug. And under Medicare Part D, they say that drugs under these categories have to be covered. And the reason they've done that is so that somebody can't design a plan that's going to cherry pick and say, well, we don't want anybody with cancer or HIV or diabetes, so we're just not going to cover those drugs. So under Medicare Part D, they're required to cover drugs within that certain therapeutic category. Well, if you're the manufacturer that makes that drug that treats it, has to be covered. It's very, very hard for an insurer to negotiate the price with you because you're the only one that covers that particular medication. So it creates a problem with negotiating the pricing.
We have a good answer. We have one more question. It says, how has COVID affected the importation of drugs from abroad?
I can tell you that logistically it has affected, it has impacted things, meaning it slowed down the process of the medications getting delivered. I don't know about any of you. I can tell you my wife is a Amazon Prime addict. When I come home, there's always 3 or 4 packages outside my house. she's told me that, things that used to deliver in a day or two are now taking a week or two to deliver. So I can tell you that packages that were coming from overseas, even coming from Canada, were delayed from what the United States Postal Service is telling us, which obviously has their own issues right now. But they're telling us that simply packages are being delayed for several reasons. Number one, there's not as many flights that are taking place, especially internationally. And I didn't even realize this for the 16 years I've been doing this, how much the United States Postal Service is reliant on commercial flights from Europe and Canada and Asia coming into the US to transport freight. But also because the Postal Service themselves and United States Customs is social distancing like the rest of us are. So if they typically have 100 people working at a customs facility, they might be down to 20 or 30% of that. So only 20 to 30 people. So obviously the packages are moving through slower. So we've definitely had to let our customers know, when we typically tell them to order 2 or 3 weeks ahead of time, to now order, a month to 6 weeks ahead of time.
All right. Well, we've run out of time today. Bill, you've provided a wealth of information. We love your presentation. Thank you so much for sharing. And make sure that your speaker profile is updated with all the correct information so people can learn how to access the Canadian Med Store and use your services for their clients. Thank you very much.
Thank you, Keith. Thanks for having me, guys.
All right. Have a great day.
All right. Bye-bye.